Good afternoon and welcome, everyone. I'm Dr. Judy Monroe, President and CEO of the CDC Foundation. And on behalf of the Foundation, I want to say just how pleased I am that we have such a great turnout for today's webinar for community-based organizations. The COVID-19 pandemic is raging in the United States. Although the pandemic is taking its toll, there is much that each of us can do to protect ourselves and others. Community-based organizations are crucial partners who are on the front lines of the pandemic. You're engaged with individuals, public health partners, and other stakeholders in cities, towns, and neighborhoods across the country. And all of you are central to ensuring important COVID-19 prevention messages are received and acted upon, as well as launching locally focused programs to save and improve lives. I just want to take a moment and thank you for all that you are doing and have been doing throughout the pandemic. We know that your work is not easy. Starting today, the CDC Foundation is launching a webinar series specifically for community-based organizations. These webinars are designed to share perspectives, to inform key community audiences, as well as to galvanize the crucial work of community-based organizations. Today's webinar aims to advance proven protective measures, resources, and practical solutions for reaching and engaging key audiences. The CDC Foundation is hosting this first webinar, which is the first in a series for community-based organizations and their partners. So to keep us on track today, I'll be keeping our speaker introductions to a minimum, and I encourage you to check out the link in the chat box for more comprehensive bios. As you can see from the agenda, we've got an impressive lineup today and an opportunity to learn from one another. Following this brief welcome, we'll hear from CDC's Dr. Michael Beach at CDC. He is the incident manager there, and we'll introduce him in a moment about the work that CDC is doing for COVID-19 and their response efforts. And this will be followed by remarks from Dr. Maggie Rivera and Scott Packard about their work in Illinois and Houston. Then we'll have some live polling to determine what your toughest challenges are. And we'll close out today's webinar with a call to action and a short Q&A. So a few housekeeping notes before we begin. You'll be able to view this webinar, which is being recorded, online following this session at a new online resource center. Look for a link in the chat box at the end of this webinar. Submit your questions in the chat box, and we'll do our best to address the key themes at the end of today's session. We'll also be posting the slides presented today in our new online resource center. So with that, it's now my pleasure to introduce Dr. Michael Beach, Principal Deputy Incident Manager for CDC's COVID-19 response. Michael, thank you for joining us today, and we look forward to your remarks.
Thank you so much. And yeah, it's quite unusual for me to do this without slides. And so, public health people are used to slides. So I'm looking forward to this. And I want to thank the CDC Foundation for its continuing support and invitation to speak with you today. I wanted to just think about where we are at this moment in time. This is one of the greatest public health emergencies in 100 years. And our country and the world really is paying a great toll, whether we look at the staggering case and death toll or the impact on our society's structure and economy. So let's just remember the backdrop here with a new disease discovered really just in December of 2019. We first heard about this illness from Wuhan, China, end of December last year, about 10 months ago only. By the third week of January, the first cases were being reported in the US, and the US declared a public health emergency. We now have 47 million cases worldwide, over 1.2 million deaths, with the US accounting for about 1 out of 5 of the infections and deaths that I just spoke to. Europe is now seeing a renewed surge in infections as well. Tragically, in the US, today we will exceed 9.4 million cases and over 230,000 deaths. The distressing trend is that following the first peak in April, and then a larger peak of infections in July, we're now actually headed into a third peak of infections. We have a new record number of over 103,000 cases for the day, a weekly average up 20% from the previous week. Hospitalizations are up 11%, and now we see another 1,100 deaths today, up 7% from the week before. A really tragic story that's unfolding. 4 out of 5 jurisdictions in the country currently are in an upward trajectory for cases, with a concentration of ongoing infections down the center of the country, Midwest, West, down to Texas. On top of that, we've had over 200,000 infections in our frontline healthcare workers and over 700 deaths. Now, this is all within the milieu of COVID fatigue. People are tired. They want things to be different. There's cooling temperatures that will be driving people indoors, already driving people indoors. Family and holidays where people want to travel to see loved ones they haven't seen in some time. Unfortunately, all issues likely to increase transmission of virus. This is on the backdrop of a great deal of misinformation about the pandemic and needed solutions that has reduced the ability for many folks to hear or implement needed mitigation measures. I want to talk to you today because you represent those frontline groups that can and do make a difference. You likely have some of the same questions we do, such as how do we reduce infections and save lives? How to reduce the impact on at-risk groups and disproportionately impacted communities? How do we open schools and businesses safely? There's so much to share in partnership with you to help the country get through this pandemic. But I acknowledge 10 minutes is short. There's a lot of things to talk about, a lot to do. So let me share some key information about the virus and its spread that we've learned that I think can help us in planning and messaging, get us on the same page. Please visit our extensive CDC website for all the details. I can't go into them, but here's some key points. SARS-CoV-2, that's the name of this respiratory virus that causes the disease COVID-19. The data so far supports that spread is through droplets. That infected people spread while coughing, but same as talking, singing, other activities. You breathe in the droplets and you become infected too. Most transmission appears to be related to close contact. The closer you are and the longer you're close, the longer the period of time increases the risk of infection. So I think those are two really key things to think about. A large number of infected people, maybe 50% or so, have no symptoms or they're not showing symptoms yet. These folks can still spread the virus just like symptomatic people. So you actually don't know when walking around who actually has the virus or if you have it. That's a really critical thing to keep in mind. What do we know about the disease's impact? The disease is more severe in older persons, people with certain underlying medical conditions, diabetes, obesity, immunosuppression. Others may need to take extra precautions, like those folks experiencing homelessness or living in congregate housing, such as correctional facilities, also pregnant women. There's clear health equity issues with disproportionate impact on different racial and ethnic groups, likely due to clearly underlying issues related to social determinants of health. And there's been a very high mental health toll on people across the country. So how do we link arms and push back on the spread of this virus? Let's think about some of the measures where we can help each other, amplify needed messages about what we need to do, and how these actions can potentially impact the spread and the impact of this, the virus and the pandemic. So let's think about 4 W's. I'm adding one. Let's wear a mask, watch your distance, wash your hands, and be wary of crowds, particularly in indoor crowded places. Let's talk about masks. These cloth face masks, we're now just saying masks. Do they work as good as an N95 mask that a healthcare worker would wear? No, but they do perform at a level. They actually reduce about 50 to 60% of the droplets coming in compared to an N95, for instance, where if a significant proportion of the population actually wore them correctly, we would reduce the spread across the country. Studies show that they work to stop the spread if an infected person wears the mask, so-called source control. So if I'm infected and I wear a mask, I won't spread the droplets and infect other people. We're also really seeing growing information that wearing masks protects people from getting infected by someone else. So there's a protection factor when I wear the mask if somebody else's droplets are coming towards me. Laboratory data shows this. Other investigations show that people wearing masks are less likely to spread the virus or be infected by the virus in situations like air travel, households, high-risk exposure. Multiple studies also show that community transmission is reduced significantly following implementation of policies that drive masking and distancing, and that this could save thousands of lives. So it's getting people to do these mitigation measures. Watching your distance, you can imagine, is key, as I mentioned. The farther you are from an ill person, the less likely those droplets will reach you, or fewer of the droplets. Farther distance, shorter time reduces the risk of infection. Washing your hands. The virus can survive for some time on surfaces, so it's important that we clean surfaces and that both ill and well people wash their hands regularly so that they don't then contaminate other objects or they don't infect themselves. Be wary of crowded places. In these places, particularly indoors, you're closer, less ventilation, more, especially if somebody is infected that's in that particular area and you can't distance or you choose not to wear a mask. Simple solutions, but clearly really hard. They require behavioral change. That's always one of the hardest things. The other thing to think about is testing. Making testing accessible, easy to get for everyone is how we diagnose people quickly, get them isolated, and stop the spread to others. As I said, a large portion of infected persons may not have symptoms. So if those people get tested, they can isolate early and they don't spread the virus to others. There's currently a surplus of testing capacity in the country and new tests now that can be done in much shorter periods of time, like 15 minutes. So you can get your result when you're there. Case investigation and contact tracing. As we find these infected persons, we want to get them into isolation so they don't infect others. And we want to know who they've come into contact with during the time that they were ill or they were diagnosed before they were isolated. So those people can be contacted. Ask them to quarantine so they don't spread the virus and continuing the chain of transmission. That's known as contact tracing. And it's breaking those chains of transmission that's really critical to controlling the virus, but it's been extremely challenging during this pandemic. Just a couple of words about household transmission. It's one key issue we're seeing is that people may take precautions outside of their household, but they come home and they forget those same precautions. We want our home to be a refuge, our household to be a refuge, clearly. We need people, though, to think if there's somebody at risk in their household, one of those at-risk folks, take appropriate precautions, even when at home, to protect them. Clearly, though, the key is to really take part in these mitigation measures out in the community. Reduce your high-risk exposures so you don't bring the virus back into your household. Stop it at the door. Vaccine, you've been hearing about, there's a huge push to develop vaccines for the population. We're doing everything we can to ensure confidence in the safety and appropriate distribution of these vaccines when they do become available. Ensuring that we get at-risk groups and those groups disproportionately impacted by the disease to have confidence in and get the vaccine is going to be critical to saving lives. We'll need all the community-based support possible to make that happen. Clearly, though, getting the vaccine licensed and having enough vaccine to vaccinate the population is going to take time. We want it to be safe and effective as we move forward. So it's critical that we continue to promote these protective mitigation measures as the new norm. Get tested, participate in these case investigations and contact tracing, and get the vaccine when it is available. This is a pivotal time in the outbreak as we see cases, hospitalizations, and deaths increasing. So implementation of these measures is going to be critical. However, as I said, people are tired. Everyone's been impacted, whether directly through illness or through their job or other activities. They want to go back to, quote, normal life, but we have to continue the messaging that the new norm has to include these mitigation measures. We put the country at risk again if we don't normalize. So CDC is working full speed, like we always do, supporting public health departments, other partners across the country with technical assistance, guidance, data tracking, training, etc. We greatly appreciate the help of the foundation in doing that job and what all of you are doing and will do to reduce the impact of this pandemic. But as you know, the pandemic's had a huge impact on the globe, our country, all of you, your family and friends. While we wait for an effective vaccine, none of us can let our foot off the gas. We have to double down on our basic messages to the public. What we need most is for all of us to join forces, combine and amplify our voices, and drive these mitigation measures home in a way that people can easily understand and follow, and that they get it. We need partners like you across the US engaging the different population groups we know we need to engage. We can't do this individually, we have to do it collectively. Now more than ever is the time to work together, amplify our voices, reach the communities you all work in, and turn the tide on this pandemic. So I look forward to working with you in the future, and let's make a difference here. Thank you very much.
Thank you, Dr. Beach. Thanks for sharing the urgency around the mitigation measures and how we all need to come together, and the importance of the actions that our CBOs across the nation can take. And I like that linking arms together. That's exactly what we need to do. So at this time, we're going to hear directly from two community leaders who are making an impact on the front lines of the pandemic. They're going to share what they're doing, what's working, what's not working, along with some of the best advice for CBOs. So please join me in welcoming Dr. Maggie Rivera, CEO and President of the Illinois Migrant Council, and Scott Packard, Chief Communications and Public Affairs Officer of the Houston Health Department. So we're so pleased that both of you were able to join with us today to share your knowledge and experience. And so first we'll hear a short presentation by Maggie, and then we'll follow that with a presentation by Scott. Maggie, over to you. Mute. Maggie, you're still on mute. Thank you.
Oh, okay.
It's the Zoom. It's the Zoom age.
Yes, it is. But thank you so much for the introduction. This is really exciting to be able to participate in such an important beginning of a series of webinars that are sure to be a success for the information that this is going to bring to our communities. So if I can please have the first slide up. I think Anna has the slides. No.
I think the first slide's up. I can see the first slide.
Oh, can you? Let me see. Oh, okay. I think we want to go to the other one, to the very first one. There you go. Okay, well, once again, I am with the Illinois Migrant Council, and our organization has been around since 1966. Our mission has been to serve migrant and seasonal farm workers and their families by promoting employment, education, health, housing, and other opportunities to achieve family stability and economic security. Prior to COVID-19, the Illinois Migrant Council has been providing comprehensive services for migrant seasonal farm workers and their families for 55 years now. Utilizing culturally and linguistic sensitive outreach strategies has proven to us to be the most effective in servicing this vulnerable population, and it has allowed us to earn the trust of not only the migrant seasonal farm workers, but from farmers and multiple health departments as well. The Illinois Migrant Council has a team of committed staff. Some who have been with the Illinois Migrant Council over multiple decades have hailed from migrant seasonal farm worker families themselves, such as myself. We have 5 regional offices across the state where we obtain extensive experience in implementing health department programs through a person-to-person approach in their domain, such as homes, camps, and community places where they gather in our communities. This has allowed us to disseminate information about community resources. Next. So during COVID times, Although the Migrant Council has had strategies to communicate with this community, we very quickly had to learn to shift gears and implement different types of communities that align more with our times, the times that we're living now, such as the internet and other communication tools that we have available. Well, we soon reached out to those and created things like Zoom conferences or Zoom meetings so that we can quickly disseminate information that we wanted to get to our households. Well, we also soon found out that for many, this is not something that works because of many different reasons. Perhaps because they don't have a smartphone, a laptop, a computer at home, or in some cases, they don't even have access to internet because the most of the people that we provide services to are in rural areas. So we had to retrace back our steps and go back to the old-fashioned way of communicating with them on a one-on-one basis. As you can see on the picture on this slide here is we actually had a call to them to come to us in a given place so that we can then provide information to them. We even went as far as providing incentives like 500 gift cards for them to be able to participate on a virtual meeting. But again, many things got in the way. So what we found is that talking to people was the easiest way to do it. And one of the important things that we found that it was really important was that we needed to communicate with them to diffuse all the messages that we're getting channeled to them through TV, radio, online. It was just literally confusing the information that was being given out there. But because we have such a strong relationship with the health departments across the state of Illinois, we were getting that information firsthand. So the health departments have been our backbone through this pandemic in us getting the information to our communities the way it should be. And because we've been able to gain the trust of our communities, they were very willing to take in that information from us coming directly from the health departments, knowing that this was the true facts, not what was being posted in Facebook or Instagram or any other social media. So we tried many different ways, like directing them to the health department so that they would be able to get information directly from them. But again, we ran into the dilemma that many of them did not have the know-how or the tools to be able to access that information. So it's a lot easier for us to, again, go back to the old-fashioned way of posting flyers in grocery stores, in laundromats, and in other places where they were still open to the public, where they can get that information firsthand. Although over the years we have been very close in relationships with the schools and our churches, as we all know, many of them are still not open to the public. So this was not venues that we could utilize to be able to get this information to them. So the one-on-one approach has really been very, very instrumental for us to be able to provide information to our population. So that has been probably our strongest strategy in communicating with them. So I want to just end by providing a little bit of information on what has worked for us, and perhaps some other CBOs that are listening to this may want to try if they are not already doing this. Develop and maintain strong partnerships between your CBOs and health departments. This is crucial because this is where we are getting the information to bring to our communities. I cannot stress enough how this is so crucial. Also, have a broad array of cross-sector contacts with your national, local partners, health departments, housing authorities, education institutions. They all play a vital role in combating what we are facing. Remember, one size does not fit all. Pay attention to the population that you service. tailor your information according to their needs, customizes language, culture varies, just take it into consideration, all those things, and use trusted partners to communicate. Do not rely on social media. Go directly to the people that know the true facts. Again, health departments are backbones with this pandemic. And again, your culturally and linguistic sensitive methods can work wonders for you. And I last one say thank you so much for the opportunity, and I look forward to any questions, information anyone may want to access from us in the near future. Thank you.
Thank you, Maggie. Thank you for your enthusiasm and the inspiring work that you're doing. And I think when you heard from her, most effective is that one-on-one trusted individuals. Think about that when you have a pandemic and you need to get the message literally to everyone. So thank you. And now let's turn to Scott Packard at the Houston Health Department for a look at how he and his team have been collaborating with CBOs and others to share key messages throughout the Houston community, particularly in disproportionately affected populations. Scott, over to you.
Hi, thank you for having me. I feel really honored to be part of this today. So my first slide, with the next one, I just wanted to give you a brief overview of our Better Together public health education campaign. So this is aimed to promote the behaviors and tactics that we all know reduce the transmission of COVID-19. Very easy to understand, mostly graphics, so it doesn't use a lot of language. Wash hands, mask up, social distance, and get tested. So on the screen here, I won't read through all of these, but as far as the broad messaging for our campaign, we're using the channels that you would anticipate, right? We're using a lot of earned media coverage. We're getting our health authority and our mayor on TV all the time talking about these preventative steps. We have a $2 million radio, TV, and print campaign that runs through December 31st. Well, that's because that's when the CARES Act funding ends, right? As part of the paid media, we also negotiated some added value from our media outlets. So for example, as part of buying ads on Univision, they're giving us 4 Facebook forums. The other, Telemundo, they're putting full screen graphics of our testing sites in each of their evening newscasts to help get that message out. We're also using influencers on social media. They reach a lot of folks in the community. Also, geo-targeted social media ads in the communities that are most impacted. Our 2 primary sources of identifying our high priority neighborhoods are the positivity rate and the wastewater virus load. That's something that we're doing in Houston, is testing wastewater for the virus. It's really been effective in helping identify where clusters and outbreaks may be occurring. And then lastly, and I'll touch on this in a slide in a moment, but our community outreach. We've reached more than 125,000 people directly so far. On the next slide, we recognize it's important to be able to get this information out to our community stakeholders so they easily have it at their fingertips to share with their network. So we're talking about our elected officials, our City of Houston departments, schools, associations, community-based organizations, the consulates, chambers of commerce, our partners. So basically what we did is we created a website, protecttheh.com. It's a one-stop shop where all of these different organizations can go. They can get a trusted voices toolkit that it gives them everything they need to talk about this virus, to use the same language that the health department is using, and to use graphics, videos, flyers, PSAs, print, all those resources they can simply download for free and use on their platforms. And this is frequently updated. For example, I just today updated our key messages document that will go on the site probably tomorrow. On the next slide, I briefly mentioned earlier the community outreach, and this is where we're definitely getting out there and going door to door in these high priority neighborhoods. It's on the next slide. There we go. So you can kind of read through some of the statistics there, but what we're doing is we're going out door to door to apartment complexes, to homes with door hangers. We're having conversations with people, and we're making sure that our outreach team is diverse, right? We want to make sure the people that we're sending out in these communities look and feel and connect with these communities. So for example, on the bottom right there, you see Dr. Faith Foreman Hayes. She's the lead for our health education and outreach. And you see some of the other images there. We're going to places like grocery stores, laundromats, convenience stores, churches, nonprofits. And while we're there, we offer them the ability to contact us for virtual education sessions so that we can give some direct one-on-one education virtually. We also, on the, towards the middle of that box that you see there, that's our toolkit that we bring to businesses. It has things like the floor decals that people can put on the floors to help people with social distancing. It has table tents that restaurants can put on their tables that help amplify the messaging. And then some other easy to use flyers, push cards, things of that nature. On the next slide, as we launched Better Together, which is phase 1 of our campaign, we wanted to make sure we were testing the message as we went along. So we did a focus group with a self-admitted group of people who say, hey, I don't follow all the rules. And we broke it down by audience segment. We have Hispanics, African Americans, and non-Hispanic whites. I have a very detailed document that I'm happy to share with the more specific findings here. But generally across all the segments, we found that people, they weren't necessarily not doing the behaviors out of rebellion. They were mostly not doing them because a lot of times they simply forgot to do it. And if they were reminded to go get their mask, if they were reminded that they needed to step 6 foot back from somebody, that they're more likely to do it. A lot of people also told us that they think that the threat is being amplified by media and it's not as bad as it's portrayed. And maybe most troubling out of our initial focus groups, across the board, people told us that they're not getting tested because it's a burden, it's a waste of time. They think that they can actually get infected at our COVID-19 testing sites. So on the next slide, as we were working to develop the messaging for phase 2, there were some quick fixes that we implemented with some of our messaging based on that. First and foremost, we kind of changed our key messages for our testing sites to free, fast, and safe, emphasizing that they are free, they're fast. A, there's not lines anymore, and B, you're not waiting 2 or 3 weeks for your results. Our sites get them to you in 2 to 3 days. We also worked with our Mayor's Hispanic Advisory Board to get more of the social media influencers that better connect with the community. We started doing, we engaged a second door-to-door outreach team specific to our testing sites. So if we're about to launch a testing site in a particular neighborhood, we go out the week before with door hangers to let people know it's coming. And then we also are, we started doing some out of home. So we're doing more at neighborhood markets, pharmacies, convenience stores, et cetera. And then on my last slide here, sorry, second to last slide, I'll speed up a little bit. Oh, it is my last slide. Sorry about that. So what we have, we're launching Monday, phase 2 of our campaign. It's called Don't Stop, Don't Forget. As was very well described earlier, people are starting to get a little lax with these behaviors. So that's kind of where that theme comes from. And we're trying to make sure that we speak to people's emotion and their reason. So under emotion, we want people to know that we still have to work together, that the longer that we don't comply with these behaviors, the longer this will last. We're also talking about how this is a community effort. And then on the reason side, we're trying to emphasize this virus's impact is real. It's tangible. We can show you how this virus is impacting our community through the statistics. And then also that the actions are easy. It doesn't take a whole lot to put on a mask. It doesn't take a whole lot to social distance. And if you go to our website or call our phone bank, we'll get you to a testing site. Thank you.
Well, thank you, Scott. Thanks for sharing that great impact and great ideas. It's fantastic to learn from you, and thank you. So at this point, what we want to do is turn to Sharon Moffitt, one of our CDC Foundation senior advisors, to facilitate our listening session with you. So this is a two-way street today on our webinar. So Sharon, over to you.
Yes, great. Thank you. And we're going to move very quickly to the next slide because this section is a time when we really do want to hear from you. We're going to have an interactive poll and I'll walk you through that here in a moment. But your responses are going to be so critical to help us understand how to better support you and also help inform future webinars. Capacity building assistance is so critical, as we've just heard from our two colleagues, in terms of making a difference in the communities and their outreach. We really need to understand from you, what are your challenges and also what are your successes? We together, I believe, can crush COVID. So in the next slide, I want to take you through some of the early issues that we've heard through our collective work with community-based organizations and state and local health agencies. These are the issues we're hearing right now. And in a minute, take some time to look at these, because I'm going to do a polling question with you here shortly. We're hearing and actually Scott addressed this, the public health concern from the communities, training needs of the CBO, such as financial reporting or how to measure impact, addressing mental health and access to healthcare issues. We've heard repeatedly, and Maggie did a great job helping us understand that importance of that culturally relevant communication tools, but sometimes not having access to that, and methods to pursue public and private partnerships. And also we're hearing a desperate need for supportive funding for housing, rental assistance, utilities, and food assistance. So now we're going to move to the next slide. And these are the 5 questions I'm going to walk you through. And what you're going to see is a question will pop up on the screen. You're going to be given some time to read through that, make a selection. This is live polling. It takes us a little bit of delayed time, but then you'll immediately see what all your colleagues are indicating. So our first question here is, of those major issues we just went through, what is the top issue? You can pick one. Malcolm? Great. So before you, please take a moment, read. There's a lot of choices here. We're going to make it tough on you, though. You only get to pick one. What is the top issue for your organization? Take a moment to read through these, and then I'll call the question. Just hit on the dot, and then don't forget to hit submit. And in 10 seconds, we're going to close this polling. Great, the polling is closed. And if you'll bear with me just a minute, we should, if Zoom is cooperating with us today, we should be able to see the results of our question. Again, I think you heard earlier from our colleagues, a number of these points have already been made in terms of the challenges. And sorry for the delay. I think that has to do with the volume of the number of people that we have responding. And here you go. So as you can see, right at the top, one of the highest areas concern is that of addressing the public health concerns in our community. Exactly the reason why we're here together and why this work is so important. And you can also see several other areas in the issues around access to mental health and access to health care, and also access to the culturally relevant materials. So now I'm going to move you on to the next question. And again, thank you. So the next important question is, what have been the successes of implementing COVID mitigation in your communities? This one, we're going to be kinder. You're going to get to pick any and all that pertain to your work. So take a moment, read through these. We believe these are some important ones. If you have others that you want to suggest to us, please use the chat function and you can add to it. You can still vote for other and then just give us more detail, or if you have a website or a link or a reference, put that in the chat. And as people are making that final selections, don't forget to hit submit. And we're going to give you 10 seconds and close the poll. So the poll is closed now, and let's see what our results are. And this is in regards to the successful mitigation strategies that you and your organizations and your communities are already using. And again, with so many participants up, look at that. So 67% of you, that says your partners in the community have helped deliver the message. What a key important learning for us all. Certainly heard that from our colleagues in Illinois and Houston and our ongoing work. So now let's quickly move on to the next question. And again, it's so important for us to hear from you. What are the challenges you are actively working on at this time? This is again one that you can pick multiple choices. Take a moment. There's may take a little longer to read through this list. We had a hard time narrowing this list down because we had heard so many challenges from you. As you make your selections, don't forget to hit submit, and I'll give you 10 seconds before we close the poll. Okay, let's close the poll, and in just a moment, we'll see the results. And it's so important that we hear and understand from you these challenges. As I said earlier, this will inform the foundations and our partners' ongoing work to support you as we go forward. It will also be extremely informative as we develop future webinars with you. So the resistance from community members to adopt COVID prevention measures, 56% of you indicated that as one of the highest challenges that you have. Obviously an area we need to work together, and one of the main reasons that we're here today together to crush COVID. Again, you'll see some other areas here that people have noted: limited access to internet for community members, and also need for clear communication messages. So now we have just 2 questions left. I'm going to break these questions down. The first question, we're going to have only those of you that are community-based organizations to respond. This is just yes or no. And whether you have a local or state health agency partnership that you're working with. And in a moment, don't worry, health departments, we're going to be coming back to you, but this is only for our community-based organizations. I'm going to close the poll here in just 10 seconds. Again, don't forget to hit submit. Okay, we'll close that poll. And this is important, as we just heard from Maggie, as we look at the results of this survey poll. As Maggie indicated, how critical it is to have that relationship with your local and state health agency. So this is very positive news for us all, that 82% of you with us today have currently are working with your local health agency. So now let's flip that around, and we're going to ask the same question of our local and state health agencies that are on the call. We know we have a number that have been able to join us today. And the question is, are you currently working with CBOs in your response to COVID? Again, yes or no, and submit. And in 10 seconds, we'll close the poll. Okay, we're closing the poll. Let's see our results. And we have 77% of those in our audience from local and state health agencies that have a working relationship with CBOs. So again, in summary, so valuable to have your information today. Appreciate the time that you've taken. This will be very important as we go forward. Several key things that we heard today that we will continue to work on as we move forward. And I thank you for your time. And at this point, it's my pleasure to turn back to Dr. Judy Monroe.
Thank you, Sharon. Thank you all for participating in the polls and for joining us today. So the time is now. Now is the time that we all must double down and dig even deeper to mobilize our communities to act decisively using the tools that we have in our toolbox right now. So to reiterate what we've heard today, here's our collective call to action. And Dr. Beach gave us 4 W's. You may have heard of 3, but first is together, let's help our communities while protecting ourselves by practicing the 4 W's of wear a mask, watch your distance, wash your hands, and be wary of crowds. Second, remember that one size doesn't fit all. You heard that today. Communities are different. CBOs are key partners in helping to reach unique populations in our different communities. And we want to learn from you. We want to hear the creative innovations that you've done. So partner, collaborate, customize when needed the methods, and to get those key messages consistent with what the health departments are offering out to the populations. Third is embrace and use different communication channels and the trusted community messengers, print, media, social media, billboards, toolkits, and what else have you used that you can share with us? Build on what was presented that Houston is doing. It's also flu season. So number 4 is get a flu shot, model the way yourself and spread the word. And 5th is access the new CDC Foundation Resources for Community-Based Organization webpage. You can see in the chat box that there'll be a slide with the link for this, and we'll be putting out more information. So the time is now for all of us to come together, link arms. Together we can crush COVID, and we need to. So with that, what we're going to do is move to Q&A. And I believe my first question actually is for Dr. Beach. I believe, hopefully he's still with us. Is that correct? Still
Yes.
with us, okay. So your first question is-
Can you hear me properly? I see in the chat that I was going in and out or something, so.
I can hear you now. How are we doing? Anybody in the chat need volume up?
I'm going to try and call into this number.
So the first question here is first a thank you for the opportunity. And the question is that this individual has a family member that was exposed to a person that is COVID-19 positive. They tested negative, then started quarantine as a preventive measure. But 3 days later, she started having symptoms. Is it possible to have a false negative test, or is it possible to get infected after testing negative? And when should she be tested again is the question.
Yeah, I mean, that's it's a great question. Meaning, just because you've been quarantined doesn't mean that you may be infected, but you're not going to show symptoms or show the virus for a number of days. And so you can't really test out of quarantine that early. We want people to, it is good to test to make sure that you can get into quarantine, but at least, especially if you have illness, it can be about 10 days before you're really going to end that. If not, it's a 14-day. If it's quarantine, meaning just an exposure, you really need to stay 14 days because you could become ill during that entire time period, even if you were negative at the front end. So there's a curve of how long it takes to get to actually become, start showing symptoms and that sort of thing. The incubation period, as people refer to.
Thank you.
Did I hear the question correctly?
I believe so.
Okay.
I'm going to turn to Dr. Waddell. Are there other questions? Do you have some? I'm not seeing in chat, so I might turn to Dr. Lisa Waddell. Do you have any additional questions? And if folks have questions, please put them into the chat. Here's a question. Here's a question actually for all the panelists while you're looking, Lisa. How is everyone changing messaging with the upcoming holidays? As Dr. Beach referenced, holidays are increasing risk. So how should we be thinking about the messaging differently with holidays coming up?
So in Houston, we're telling people that to limit holiday gatherings to their immediate household members. We're telling them we know this is another inconvenience, but it's something that we're going to have to do to continue to slow the spread. And then we're also telling people if you must go to a gathering that includes non-household members, create a bubble around yourself. So consider quarantining for 14 days before and after.
We do have some additional questions, Dr. Monroe. One question that also came in for Dr. Beach was, should we be encouraging regular frequent testing to address the problem of asymptomatic spreaders?
And that's a really great question. And I think that the answer that we're coming up with here, and we'll have guidance, some considerations coming out soon, is that we do want to increase the amount of testing, particularly amongst asymptomatic groups where we expect to see some transmission, because we're not picking them up. And so the more that we test, the more likely we are to find those silent spreaders, as people are talking about, and be able to get them into isolation so we can break the chain of transmission. So we really do want to expand beyond just symptomatic people to other groups where we can pick up those asymptomatic or pre-symptomatic folks and get them isolated so that we aren't continuing the chain of transmission.
Great, thank you. A couple of additional questions for our speakers. So one was a question around the virtual education that was done, and folks are interested in hearing about how successful that was. And also with regards to the survey, Maggie, that you deployed in communities, you know, how was that survey provided if folks did not actually have the internet? So how did you overcome some of those barriers? So perhaps Scott can.
Yeah. So what we did is we were fortunate enough to be able to get funding from the state COVID resource fund in 2 of the 5 rounds here in the state of Illinois. So when we identified the families in the communities, we took the information via phone as much as we could, but to deliver the cards, we actually met with them one-on-one. And at that point, we were disseminating the information and taking information from them. One of the big, I guess, questions in our application, if per se, is, have you been affected by COVID? And if so, how? So we took like a statement from them, and we kind of pried into a little bit more, how are things affecting you, family members, and we also asked, in your own words, from a list of 15 different things, what is the most impacting thing in your household because of COVID? And again and again and again, food kept coming up. That was probably like the number one thing. So we did this literally one-on-one. We tried to do that on several Zoom meetings where we said, if you log on and you hear the information, we will give you a $500 gift card. Well, of course, first they had to register, and then secondly, they had to log on. And for them, that was like, that's too hard. It's too confusing. So I think we ended up doing 3 focus groups of like maybe 15 people apiece. So at that time, we decided, no, this is not something that is going to be successful. So we went back to the one-on-one.
Okay, great. So I'm sure those are helpful tips for many that are listening in. And Scott, did you have anything you wanted to add regarding the virtual education? And then I think a question maybe for all 3 speakers is this notion of partnerships, and what is it taken for you to forge the strong partnerships that you've identified as necessary to really get all of these key messages out in so many important ways?
On the first part, I really wish Dr. Foreman Hayes was here, because she's really the brains behind our outreach and our virtual education. But it's been well received. These groups, when we do the outreach, we ask if they would like some sort of virtual education session. A lot of them say yes. And with our toolkits and our materials that we're giving to and the resources to the stakeholders and the community-based organizations, it's been effective, because some of them are actually coming back to us and saying, hey, can you help us shoot a video where we can use our community people to help deliver this message? Can you give us graphics that we can add our logos to? Can you give us flyers that we can add our logo to? So I think it's been successful in that regard too.
And for us, I just want to echo on the fact that having this kind of partnerships allows you to disseminate the information on light speed. Being able to have those partners in different areas. Well, we're statewide, so we cover the entire state. So it's very important for us to have those partnerships and be able to pick up the phone and say, hey, you know, we're going to be in your area, gather me 100 people because we're coming in with food, clothes, whatever, you know, and of course, CBOs know their communities. They know who the people are mostly in need. Mm-hmm. So they're able to identify those families right away and disseminate the information. Hey, this is coming up, you know, we want to be part of it, invite them. And that has been really, really an important tool for us to be able to lean on those partnerships that we've had for so many years. Now the Migrant Council has done this with many different programs, especially the health programs, because if our communities are not healthy, they can't work, they can't learn, they can't think. So we have always done this with the health departments. So having had that experience has really been instrumental for us.
Great, thank you.
I was just going to add one thing just from the federal level is that this is all about partnerships. As you said earlier, one size doesn't fit all, and it's listening to people. And so we want to hear from as many groups as possible about what is needed. What's the type of linguistically correct information? You know, do we meet the needs of the groups that are actually going to use it on the ground? We need to hear from you about what that is, and then we use our resources to help fund it and help create materials that you can then use for that.
Here's a question. There's some other
and I want to add a little bit to that, because here's another important piece of information. There are many other organizations in our communities that are getting the same type of funding and are doing the same type of work that we're doing. So partnering with them and making sure that we're not duplicating the services and that we are covering the entire landscape so that no piece of land is left out is very important. So we have developed this partnership of CBOs that are doing the same kind of work, and we're just collaborating with one another. So that's another key point, collaboration. Sorry, I interrupted.
No, that's fine. There's some other questions that have come in as well. One question has to do with flying. Is it considered high risk to be on an airplane?
I think, you know, the data that's coming in says that it can be managed. What we see is that if mitigation measures are followed and people are masking, we don't seem to see transmission when infected people have been on planes. So I think there'll be more guidance out about this, but you know, the air handling systems on airliners are quite elaborate, and at least so far what we've seen is that transmission is generally limited. As I said, it's about close, so it's around the person who's infected, and what you want is for everybody to mask up. And so we just put out kind of strong consideration that all kind of public transport require masking to reduce that transmission.
So speaking of masking up, we have another question here. Does anyone have effective messaging for communities that see masking as an infringement on their rights?
Great question. I want the fix for that. I do think it is one of those things where it's a behavioral issue where we're going to have to learn more about how we can get people to see how the information about these actually can change their lives. And what we've seen in some of the survey data that we have is the closer you are to COVID, the more likely you are to take part in this. So if there isn't high incidence in the area, you don't know anybody who's been infected, there hasn't been severe illness, it's less likely that you're going to do something about it, versus as it reaches into your community. And now it's moving through a large part of the states now that weren't impacted heavily before. We hope that will drive interest in trying to reduce the number of infections occurring, and certainly the severe. It's a tough one.
Yeah, it is a tough one. I mean, what's the latest percentage? CDC's reporting out the percentage of the population wearing masks has increased, correct? But then wearing them correctly and in all settings.
Yeah, I mean, I think we hear people, and it's people saying they do it, in the 70s and 80%. Well, are you using it appropriately? Are you doing it at all the critical times? I think there's also a bias towards telling us what we want to hear. I certainly don't see that around where I am, and it depends on what location you're in and what age group you're with. And so, the problem is that it separates out by age and by region and so on. We need uniform. When I said mask usage will help reduce transmission, you don't want it spotty that all 18 to 25 don't mask and other people do. We need to have it distributed across the population that's being infected. So we certainly need to improve what we're doing so far. Unified messaging is what we need.
Yeah, thank you. We have come to time, so I want to be respectful of everyone's time. We do have questions we didn't get to, and we will be posting, if you come to our website, we're going to be collecting more information, tailoring specifically for community-based organizations. We do realize that there's a wide variety of community-based organizations, but I think for today, we really wanted to engage all of you, to learn from you, and all of us can help model the behaviors and spread the word, regardless of what our jobs are. And so there will be more to come. And again, thank you so much for your time, everyone. We'll end on time and wish all of you good health and stay safe.
Thanks so much.